have been gone for a little bit. We've all gone through it this past year with the pandemic. I hope all my subscribers and viewers are staying safe. Today, I would like to go over composite restorations, and I feel we are coming into a time where if you can suggest two, you notice how I did that like that, so you don't touch your glasses. A lot of students, and I go back and forth, so take notes. But what I like to do is, as I go through the motions, if I catch myself doing something, I share it with you. And a lot of times when I was teaching in a classroom, students would, these are clean, but what they would do is go like this and touch their glasses and fix their mask. Well, you do not want to do that with gloves on. One, you're contaminating the gloves. Two, um, you're contaminating your face. Okay. So, and we have to put our hands in patients' mouth, the oral cavity. So what we're going to do is we're going to take the catalyst. I've seen doctors scratch themselves with their gloves on. Hey, they forget sometimes. It's like second nature after a while. Yes, I'm one of those dental instructors. If you're new to my channel, you know I'm just raw and real. So what I'm going to do is demonstrate the difference. So this is acid etch. Okay, it comes in blue or green, and they even have red. But red is more for crowns. So you put it directly onto the crown. Now, with the red, it's more toxin. So make sure that you are wearing proper PPE and you're very careful as you put the red onto the crown, because you know when you're filling up a crown, you're going to accidentally touch your gloves. Well, acid etch can go through the gloves, okay, and later on cause you health problems. And I'm trying to avoid that for you, okay? I hope everybody's having a blessed day. So what I would do is normally, okay, if I'm using the monitor technique in the syringe and you want to switch this out after every patient, okay? And this should technically go into the sharps container because it is sharp. A lot of dental offices just throw it away in the trash, okay? You have to follow the rules of your doctor, what they want you to do, but you also have to know that you can lose your license if you are doing things that are wrong, because it will always fall back on the little person, okay? So you would take this off and put a new one on, okay? Or put the lid back on. A lot of people just wipe them off. But see, in today's times, as we put this onto the tooth, okay, and we squeeze it out just a little bit, it's touching the tooth, ain't it? You hear that? All right, now, so it should be switched after every patient, okay? Next, this is the old way, okay? The old school method. It is etch in a bottle, okay? And what you would do is you would take a drop, be very careful with it, and etch and bond and composites all expensive. And doctors watch how much you use, trust me. So if you're nervous, just take a little bit. And some bottles come out more faster than others. Let me sit this down and do this. You can tap it in one drop, okay? Because it tastes like lemon juice, because it's like a cleaner like lemon juice, okay? Now, normally I would have a mask on, and normally I would use a microbrush, but because of the past year I've had, I'm going to just use a cotton tip applicator, okay? And I'm going to take the etch, and I'm going to apply it to the patient's tooth. Same way I would have done with the syringe. Now I'm going to let it sit there for how long? Do you remember from the website? If you haven't seen the website, it's dentalindexjunior.weebly, weebly.com. All right. And that's the junior one. Drop the junior, and then you got the professional page. Now I would wait 30 to 60 seconds, and then I will grab my air water syringe, which I don't have on because then you're not going to be able to hear me record. And I would, if you doubt, this is really important because I know you're new in the field, there's air and water. So if you need to, check a little bit on something, a 2x2. This isn't a 2x2, but it looks like a 2x2. And put it on there. Okay, a couple drops to see if it's air or water. Because once you rinse this and put the bonding agent on it, It has to stay dry. It's a must. So you would make sure you rinse, okay? And I always rinse, and you can use the HVE, or if there's a cotton roll up underneath the lip and behind the tongue, then you can use your saliva ejector. But you can put it right there. I used to like to suck off the etch before I even rinse. That way, when you use the syringe, it can push off into the back of the throat, and it tastes awful for the patient. So I would go ahead and put my suction and rinse, okay? And then I would dry it really well. Sound effects. Dry it. And I'm facing towards the gingival, because if I go this way, any saliva that's in the gingival region will creep up onto the tooth and contaminate it once it's etched. Okay. I normally don't put it over the patient like that, but some doctors do. Now, the next step after you etch would be your bonding agent, right? The modern version. And after you put a little bit on a microbrush and place it right there, the tooth should look chalky white if you etched it well, okay? In most states, the dental assistant is allowed to etch the tooth and put the bonding agent, but the EFDA or the dentist needs to do the restoration, okay? But if you learn how to do that, the more you can do for your employer, the more it should benefit you. Okay. Now what I'm going to do, instead of using the one step, the old school technique is you got the catalyst and the base. And I'm going to go ahead and put a drop of each. That was the base. And it doesn't matter if you do A or B first, as long as you get the exact same amounts. Okay. And you put it in here. Now, the reason why, and I'm going to mix it, and if I had a microbrush, which is a little miniature Q-tip, okay, with microfibers on it, disposable ones, different colors. When you mix the two together, and it's the even amount, it will self-cure on its own. So say there's electricity that has gone off because of a tornado. I'm just demonstrating. Use your imagination that this is a microbrush. I'm going to put a little bit on the tooth. Okay. And if you do orthodontics, they might use this technique still. A little bit on the tooth. And then what I normally did, okay, because doctors have taught me this through the years, is to spread it into the dent and tubulas. We would take the ear and we would do what? Face up or face down? We're going to face down, okay? And blow just a little bit of air to spread it around the tooth. At this point, the bonding agent has self-cured, and then I'm going to take the catalyst and base of the composite material. Notice the colors. Never been used, first time. Take a little piece out, about that much, okay? Size of a pea, maybe even half the size of a pea, depending on how large the filling needs to be replaced or new one, okay? Every time they do a new restoration on the same tooth, say it had a prior occlusal filling and now the cavity has crept or a new cavity has created in approximately between the teeth, well then what will happen is it would be an MO then. So you would need more material. So always look ahead. You got to be one step ahead of the game and look into the mouth and see how much you think will be needed, okay? And you don't want to have to ask your doctor for every little thing. So learn their techniques, okay? And I like to put the lid back on it, okay? So it doesn't dry out. Now here's the thing. I'm working on a real patient. I'm touching this container. Make sure you clean the container, okay, on the outside with a cavity wipe or the side wipe. Now I'm going to, if can you see well, because I need to be on a flat surface. And I have equal amounts. Now this is the part you got to move fast. And on top of this, you need to make sure you blend it well. So I'm blending it. Now there's few shades for the self-cure composite, but I really feel some dentists should have it on hand, and you can keep it in the refrigerator for it to last longer. Composite material, okay? Just like batteries. A lot of people don't know that. And I'm mixing it up and blending it. And then what I'm doing is, because it's going to harden on this little spatula, even though these are disposable, doctors still reuse them. Okay? And you just wipe it off like that. And there's nothing wrong with that because it doesn't really go in the patient's mouth and it can go in the cold sterile. Now remember, when you put stuff in the cold sterile, always wear your gloves because one, your fingertips will turn yellowish, and two, um, you need to make sure all the bacteria that's already in there, it's got to soak for 10 minutes to be disinfected, 10 hours to be sterilized. So if you're putting something that goes into the oral cavity and then you're just letting it soak for 10 minutes or till the afternoon patients, it's not sterilized. So be sure that you know that because OSHA will check on people. It's called TOSHA in the state of Tennessee. Now, I have my composite placement instruments, okay? Now, as long as it looks like that, it could be gold, it could be silver, or it can be made out of Teflon, okay? But this is a composite placement instrument. They have the football one, just like for amalgam setups, they have it for composite nowadays because there's so many post-nerve restorations. And I'm going to take a little bit. Now, if I was the EFDA or the DDS, I would come around the patient's head like this. Can you see okay? Okay. And I'm going to apply it. Say they needed a facial. They had a little pit and fissure facial. I'm going to go ahead and put it on there. Now, I would have a 2x2, or some doctors just go ahead and put it on their glove in case they need some more. And then I would dip it into my fining solution if it's still moist, and I would smooth it out. It's just kind of like art. And you just place it just like that. And make sure you get some from the interproximal regions that's not going to cause an overhang. If you're doing a mesial towards the midline or a distal away from the midline. See, anything little, imagine a mustard seed or some type of seed that's very tiny and it's in your mouth or even a popcorn kernel, you can feel it there. So it has to be as smooth as possible so the patient is comfortable even after anesthetic has worn off. Now, some patients don't need anesthetic for a tiny little class 1 restoration. Now, I've seen some dentists take their gloves, even though they probably shouldn't, and put the bonding agent on the top of their fingertip and use your finger to smooth out the restoration. See? Now, with this being said, this tooth now has a facial composite and it does not need to be cured. It is already hardened. Now, you will still go through the steps of using a 3M disc and smoothing the restoration, okay? And you would even ask your patient, hey, can you take your tongue and feel it? Does it feel smooth? You know, you always want to check with your patient. The next thing you would want to do or get ready to hand to the doctor is the explorer. Once you place the restoration, the doctor is going to need to make sure it's set up. So hand them a shepherd's hook explorer, an ortho explorer. It's totally up to the dentist and what you guys use. And then they would take that explorer, check it just like that, and see if it's hard and see if there's any overhangs, okay? Because if the patient goes home and then tries to floss and they bring that floss back up, they could pop the filling out if there's an overhang. And plus, plaque and debris and sugars that are so fine can creep right there and sit on a ledge and eat at the tooth with the bacteria and the plaque mixed together causes the decay. Now, when they floss, you tell them if you floss and you feel like you can't bring, same with a new crown, you feel like you can't bring that floss up, then take it out the side, okay? And have them call your office before just walking in, because it would take about 5-10 minutes to adjust it. But in the same sense, it takes 5 to 10 minutes to clean a room properly, you know, and walk-ins, you don't want to overload in walk-ins, okay? So I wanted to share that. Now, if you were in a dentist's office, right now you're still sitting in school, maybe you're doing an externship, you would have a composite gun and all the shades are right there for you. Okay. This one is shade B2. Okay. The most common shade is A2. And there should be a shade guide, okay, somewhere in the office for you to, kind of choose the shade or check the patient's record. You should always check the health history before you see the patient. And then if they've had previous restorations, you can go ahead and check what shade did they use last time. Maybe a filling just popped out, and that's what you would do for that. All right. Now, when you take your gloves off, um, to get ready to write up the chart, you remember because of COVID and just because of all the germs out there, I always took mine off like this and turn them inside out. So I'm not even touching what's been in the mouth, okay? And then dispose of them in the wastebasket. I'm sorry if I've neglected some subscribers, but we all go through some things in our life. And I had to do that even as a dental instructor. And that's what I think about these kids nowadays in school. They don't realize that maybe your teacher's going through something and she can't teach 100%, or maybe something's going on to distract her. And when the students come in to the classroom being rude to the instructor, which I know dental students can be rude at times, there's always a know-it-all in the classroom. But you have to respect your instructor and know that she's there getting paid an hourly job, probably not as good as some of you guys will leave there making. Okay. So keep that in mind when, you come across a dental instructor you might be a little bit on edge with, because you could be an older student and the teacher, the instructor is younger. But here's the thing, they've been in the field. You haven't been. So let's pass that respect forward. And I would like to take the time to say that I did, before everything kind of went haywire, um, gave my classrooms on Google for free, and I have put them in the community. If they're not there, reach out to me. Email me at dental assistant instructor DIY@gmail.com, and in the subject say Google Classroom in capital letters and which one you need, okay? And I can send you the link. It's free. You can study for your RDA, your CDA, your radiology exam 24/7 anytime. I included games and everything. And, just let me know how it helps you. A lot of people are just passing off the videos, but if they have the classroom too. But don't forget, you can probably find it on my dental index junior.weebly.com website. And if you have a dentist that just needs a laugh for the day, or needs to find something out about insurance, or needs a temp, or if you're looking for work, dentalindex.weebly.com will also help the dentist. I appreciate you watching this video. And if you would like to donate to my classroom so I can keep on going forward with my YouTube videos, because materials do cost, you can send donations to my Venmo, which is under Teresa Biggs -2, or Heavenologist, and that's under Cash App, Venmo, and that's HEAVEN, Heaven, like a meteorologist, Heavenologist, OLOGIST, Heavenologist, and I would appreciate them. Thank you so much, and don't forget to become a member to this channel. Take care.